Hi, this is Dr. Marshall. This is going to be the first video of the second part of the 1-1 external and internal directional and locational anatomy assignment. And if you're here, I'm assuming that you got here by going to the homepage of the medical forensics assignment, and then clicked on assignments, and then clicked on part 2 of this assignment, and then you've printed out the worksheet and then also have started the Nearpod lesson. And we're going to go ahead and join the lesson. And so we've previously talked about the external things. We've talked about the directional terms, the external landmarks, and it's ultimately not that difficult to look at the human body and give names to and remember where those anatomic locations are, but that's partly because you can see the outside of the body in detail. It's much more difficult to visualize the inside of the body. In particular, surgeons must have an exact image in their mind of where everything inside the body is and how each part relates to each other. Not only that, they have to have a good knowledge of how these relationships can vary, because not everyone's anatomy is exactly the same. This is a link to a page that shows a large number of variations on how the blood vessels that supply the head and neck can arrive from the large vessel that leaves the heart, which is the aorta. And so you can see this is the normal anatomy right here of the aorta. I have a branch that comes off here, and it branches into two branches, and then I have a second and a third branch that comes off of the aorta. Okay. Well, I could have a situation where the first branch here off of the aorta actually almost is split in two and has two individual branches. I could have where the second branch is actually coming off, or is coming off of the first branch instead of forming a second branch. And I have a whole bunch of other bizarre anatomical variations here. For example, the right subclavian artery, which is supposed to be right here, could actually come off the aorta all the way over here and cross over the midline and do that. I could have 4 separate blood vessels. I could have just one blood vessel come off instead of the one that splits, and then I could have the second blood vessel split into 3. And so you can see that we have all of these different variations. So we've got to have a good idea of what we could possibly see inside the body and how it relates to other things. So one of the ways that we can help is to create an internal frame of reference using imaginary geometric planes that cut through the body at various points. These planes are also referred to as sections through the body. You need to know 3 standard planes or sections as illustrated below. The first of these is going to be called the Sagittal Plane. And sagittal is from the Latin word that means arrow. This comes from the appearance of the suture that holds the midline of the skull together. It looks like an arrow. And we'll see more on that later, but for our purposes now, you can think of an arrow piercing the body from the anterior to posterior in the midline. In any plane, anterior to posterior dividing, and so this is that plane, anterior to posterior, dividing the body into left and right portions, is called a sagittal plane. So if I move this plane over a little bit, it would still be called a sagittal plane. It just wouldn't be the sagittal plane that's in the midline there. So it doesn't have to pass through the midline. The one that does pass through the midline is called the mid-sagittal, or is called the median plane. Okay, so the mid-sagittal or the median plane. So what goes in 24 and 25 I've typed out there for you. Okay, so that's the sagittal plane. And I just want to show you where this got its name. Right here is the skull, okay, and here's the frontal bone, or the front of the skull, and right here in the midline we've got this is called a suture, but it's a place where the bone sort of is irregular and interlocks with each other from either side. But you'll notice that down here it looks like the fletchings of an arrow, so the early anatomists called this the sagittal suture, and that's where the sagittal plane got its name. Okay. The next one of these is going to be the coronal plane. You can see that right here, and this goes from left to right, and it divides the body into an anterior and a posterior part. And a coronal plane is also called a frontal plane, and a coronal plane that divides the body equally into anterior and posterior portions is called it's also called a mid-frontal plane. Okay, and then trans is a prefix from Latin that means across, and verse is a Latin word from vertere, which means to turn. So transverse plane is any plane that cuts horizontally through the body. Okay. So those are the planes that we're going to use to help us with landmarks inside the body. Another useful division of the internal body structures is the dividing of abdominal contents into one of 4 quadrants by picturing intersecting lines passing vertically and horizontally through the umbilicus, or the navel. Okay, the resulting quadrants are designated the left upper quadrant, the left lower quadrant, the right upper, and the right lower quadrant. This is useful because certain anatomic structures lie specifically within certain quadrants, making it more likely that symptoms and signs in one or another quadrant are more likely associated with certain organs. Now, you'll not know many of these structures for a while, and I've given you the following diagram illustrating these associations. Okay, so you can see if I look in the right upper quadrant, I've got mostly the liver right here. Okay, I've got mostly the liver. I have the spleen in the left upper quadrant. I have part of the descending colon in the left lower quadrant. I have part of the ascending colon in the right lower quadrant. I've got part of the stomach in the left upper quadrant, or most of the stomach. I've got the right kidney in the right lower quadrant and the left kidney in the left lower quadrant. I'm sorry, right upper and right lower quadrants, or right upper and left upper quadrants, and so forth. So you don't need to know these, you just need to know of the idea of quadrants and the idea that different signs and symptoms that you might read on an autopsy report or something like that would be more common in certain quadrants of the abdomen. Okay. Then finally, you're probably aware that your internal organs just don't sit inside the body encased in solid tissue. In particular, your heart and lungs are in constant motion and need to reside within a space where they can expand and contract Likewise, organs of the digestive tract expand and contract as material moves and is moved through them. And the digestive tract, the large intestine in particular, can become massively distended when there's lots of gas in it. It can be up to 5 or 6 times its normal diameter. You'll actually sometimes see this at autopsy related to a variety of things. But in any case, you need to have this space for these organs to be able to move and expand and contract. The linings of the body cavities also allow for flow through the cavity of a controlled amount of low viscosity. That means very slippery fluid that coats the surface of the organs, almost kind of like a soapy material. And it allows for them to move against each other and against the lining of the cavity without being ripped by friction. As the fluid is not really all that compressible, the fluid within the spaces surrounding the organs also acts as kind of a shock absorber, and that cushions the organs from the everyday impact and vibrational trauma. Another advantage of this is that the presence of the lungs inside a closed cavity, with the outer surface of the cavity separated from the surface of the lungs by only a thin layer of fluid, allows for creation of a vacuum in the lung cavity. And when that is present, as it always is, when the chest expands, it literally pulls the lungs open, drawing air into them. Okay, so when I expand my chest cavity, I'm not really sucking air into my lungs. I'm not actively pulling air into my lungs. I'm expanding the lungs themselves, and that lowers the pressure inside of the lungs, and then atmospheric pressure is greater than the pressure inside the lungs, and that pushes the air inside. So I'm not pulling air inside my lungs. I'm creating a situation where the atmospheric pressure is greater than the pressure inside my lungs, and that's what pushes the air into your lungs. So to summarize, we have many functions of the body cavities, at least to provide space to move for those organs that need the room because they are in motion. Fluid creates low friction surfaces to prevent frictional damage. Fluid also provides a cushion against mechanical trauma. And then the uniform development of a vacuum is allowed for expansion of the lungs. And that's something that could also be necessary for your understanding of what happens when we have knife wounds or penetrating wounds to the chest that might be part of forensic cases. Okay, so go ahead and go to the next slide. Okay, so anatomists recognize 2 main body cavities: a blank cavity which houses the thoracic, abdominal, and pelvic organs. So that's going to be this one here. We're going to call that a ventral body cavity. And then the one that's toward the back is going to be called the dorsal body cavity. Okay, and we're going to have to stop the video here because we're pushing our 15 minutes, and so just stop this one and go ahead and go to the next one.